Many, many, many years ago, we actually used to think that HER2 positive was the worst because it was so aggressive in nature. And then after that, we started to think that perhaps triple negative was really bad because, again, very, very aggressive, and we really only had chemotherapy. But then within the last few years, immunotherapy has come into the picture with triple negative breast cancer. And now I have many patients with triple negative who are doing really well as well. When it comes to triple negative breast cancer, you're asking about. So let's just talk about a scenario, a very typical scenario where somebody is going to be getting the chemotherapy and immunotherapy before surgery. So my goodness, it is a long road, let me tell you. So the chemotherapy portion alone is 6 months. And those first 3 months, these patients are getting treatment every single week. So it is 12 weeks in a row of getting chemotherapy once a week. And after that 12 weeks, they then have to get another 4 cycles that are 3 weeks apart. So when you add it all up, it's going to be 6 months total of getting multiple different kinds of chemotherapy, as well as immunotherapy being given at the same time. Then, after all that is done, somebody takes a break for usually a few weeks, perhaps sort of somewhere in the range of 3 to 4 weeks, and then they go back to see their surgeon and are planning to go ahead with their surgery. And once their surgery is done, typically they go on to meet the radiation oncologist. They don't necessarily always get radiation, but I would say most cases they do get radiation. And keep in mind, this entire time, they're continuing to get their immunotherapy every 3 weeks. After radiation is done, they often come back to the medical oncologist, and there are potential other treatments that can be added. So, for example, there is a pill form of chemotherapy that could be considered. And triple negative breast cancer has a strong association with BRCA as well. So if somebody has been found to have BRCA, there is a different kind of pill that could also be considered in that situation. So it is certainly a long road, but I have to say that we do this all for good reason, because with this new regimen of chemotherapy and immunotherapy, we've had many, many patients have much better outcomes than they otherwise would have before this all existed.
So you're talking about like almost a year and a half of therapy.
Yeah, somewhere in the range of, you're right, about a year or a year and a half. And then if we're going to be talking about more pills at the end of it, and then maybe even a reconstructive surgery after all of it, tacking on even a little bit more time. It's definitely a long journey. Yeah, it is a massive disruption to somebody's day to day. And especially when it comes to triple negative breast cancer, a lot of these patients are very young. This breast cancer has a predilection for younger women. So incredibly disruptive in terms of their home life, in terms of their work life. In fact, this is why I wrote my book, because a lot of these patients have little kids and they don't know how to talk to them about what's going on. So I call myself a professional form filler half the time because many of these patients, almost all, in fact, have to go on disability or take some time off of work. I think it is very difficult to be going through all this treatment, showing up for your family, and at the same time showing up for a job where other people are relying on you. And of course, that opens up different challenges in terms of finances and all sorts of other challenges in this journey. So it is certainly not easy for these people.